All right, today we're jumping into a really fascinating medical mystery. It's a story about a slow motion infection caused by a bacterium that, believe it or not, is supposed to be in your body. It's a normal, peaceful resident until it's not. This is the very strange case of actinomycosis. So let's start with this. Just think about it for a second. What if one of the countless harmless bacteria living inside you right now suddenly got a chance to become an enemy? It almost sounds like the plot of a sci-fi movie, but it's the very real situation behind the infection we're going to break down today. Okay, so every good mystery needs a culprit, right? To really get what's going on here, we first have to get to know the organism at the center of it all. Meet Actinomyces israelii. Now, the key thing to know about this little guy is that it's anaerobic. That's just a fancy way of saying it hates oxygen. It thrives in deep, dark places where oxygen can't get to it. And the most important part? This isn't some germ you pick up from the outside. It's already part of your body's normal, everyday crew. So where's it hanging out? Well, you'll find it in some really common spots. You know, the little crevices between your teeth and gums, chilling on your tonsils, and all along the lining of your gut and your vagina. For almost everyone for their entire lives, it just sits there and does absolutely nothing wrong. And this is where it gets so weird. It's a total Jekyll and Hyde situation. On one hand, it's the perfect neighbor, just living quietly on the surface. But give it an opportunity, and it can become this really dangerous intruder, causing these deep, destructive infections. So what's the trigger? How does it cross that line? That brings us to the most critical moment in this story. This is the inciting incident, the event that lets this good neighbor become a home invader. The whole thing is basically a chain reaction. It always starts with a trigger, some kind of injury, maybe some inflammation that creates a tear in the surface tissue. That's the breach. It's an open door for the bacteria to sneak into the deeper parts of your body, places where your immune system isn't prepared to fight them. Once they're in, they start to invade, slowly building up pockets of pus. We call those abscesses, and a lot of tough scar tissue. This can go on for months, even years, until the infection creates these weird escape routes called fistulas, which are like little tunnels that can even burrow all the way out to the skin. So now we know how it happens, but what does it actually look like? See, actinomycosis isn't just one thing. It shows up in a few very different ways, all depending on where that initial breach happened. So let's open up the case files. The most common version, by far, is the cervicofacial form. It usually starts in the mouth, maybe after some dental work, and leads to this classic symptom called lumpy jaw. And a huge clue for doctors is that the pus from these lumps often has these tiny yellowish grains in it. Then you've got the thoracic form in the chest, and the abdominal form, which often pops up near the appendix and can cause some really serious weight loss. And finally, there's a pelvic form that's often tied to women who've had an IUD in place for a long time, because that can sometimes cause the initial tissue injury. Now, given how slowly this infection grows and how it can look like a lot of other diseases, figuring out what's going on is like some serious detective work. So how do doctors finally crack the case? They have a whole toolkit they have to use. It all starts with getting a sample right from the source, whether it's pus from one of those abscesses or a tiny piece of tissue. Sometimes they'll even use an ultrasound to guide the needle to the exact right spot. Then the real work starts in the lab. They look at the sample under a microscope and then try to grow the bacteria in a dish to be 100% sure. And of course, they use things like CT scans to see just how far the infection has spread inside the body. But really, when it comes right down to it, this is the smoking gun. You can have all the scans and symptoms you want, but finding the actual Actinomyces bacteria in that sample is the final undeniable proof. That's when you know for sure you've identified the culprit. So the culprit's been caught, the diagnosis is confirmed. Now what? Let's take a look at what the road to recovery is like. The treatment plan is, well, it's aggressive. It's a multi-pronged attack. First and foremost, you hit the bacteria hard with high-dose antibiotics, usually penicillin. But that's not all. You also have to drain all those abscesses to get the pus out, and those fistulas, the tunnels, often have to be removed with surgery. And of course, in pelvic cases, the IUD that might have started the whole thing comes out. And when we say this is a long-term battle, we are not kidding. Get this, the antibiotic treatment isn't for a week or two, it can last for over a year. That really just drives home how deep-seated and stubborn this infection can be once it takes hold. So what's the outlook for someone who gets this? It really all comes down to location, location, location. The prognosis is actually very good for the lumpy jaw form, mainly because it's easier to get to and treat. But it gets a lot more serious for those deeper infections in the chest or the abdomen, and especially if the bacteria manage to spread to the brain. But let's end this whole investigation on a really hopeful note, because this is the most important part. Despite how serious it is, the key is this. If you catch it early and you treat it with the right aggressive plan, most people do make a full recovery. The mystery can be solved and the patient can be cured. It really makes you wonder, though, doesn't it? Actinomyces is just one out of literally trillions of microbes that live in and on us. It makes you think, what other secrets, what other potential good guys and unlikely bad guys are just hiding out in our own personal microbiome, waiting for their moment?